And we were kind of like, well, what do we do now? Maybe we can help out with COVID-19 testing for a few weeks until this whole thing blows over. We ended up hiring 7,000 people, and we grew it to about 2 billion of annual revenue at the peak, about 10% of all US COVID testing, 36 million tests, 2.5 million vaccinations across 49 states. Although I kind of always knew in the back of my head that I would never go back. There's an Elon Musk quote that starting a company is like chewing glass and staring into the abyss. And I would generally have to agree with that.
Hello everyone, welcome back to Nadia's Lab. Today I'm very grateful to be joined by Fred Turner. Fred Turner is a healthcare entrepreneur, a founder and CEO of company Curative. Fred was also featured in Science Council list of top 100 practicing scientists in the UK in 2013 and was ranked a #1 in European Union contest in Young Scientists in 2013. He was also featured in Forbes 30 Under 30 in Science List back in 2017. And today with me, he'll talk about his company, his interesting career path, and very non-traditional actually career path. And we'll touch base on the healthcare system in the US. Fred, thank you so much for joining me today.
Yeah, thanks for having me.
So I want to go back into how it all basically started. You were very, very young when you left UK and you moved to US, and I believe you studied in Oxford.
Yes.
And you decided to drop out. So you left Oxford, which is like one of the top universities in the world, and it is top university in the world, and you decided to move to US and start this, journey as an entrepreneur, and it was quite a bold move. So I was just wondering what was going through your head at that time, and how brave enough, and when was the moment that you decided to drop from Oxford?
Yeah, when I first started at Oxford, I thought that I would go on and do a PhD, and that was kind of the obvious path, right? If you do an undergraduate degree in a science, you go become a scientist. But kind of right about the same time as I was starting, I also started a company doing agricultural genetic testing. So basically testing beef and dairy cattle to predict various traits from their genetics. And I started this like about a month before I started like the first term at Oxford. And then it got to the point where it was just consuming all of my time, and it was far more interesting. And we had customers and people, buying tests and kind of wanting us to scale up and do more. And at the time, it didn't seem like a big risk because it was more like a pause, right?
Mm-hmm.
It wasn't that I was having to drop out and I could never go back. It was put it on pause for a year, see where the company goes. Although I kind of always knew in the back of my head that I would never go back.
Oh, wow. That's impressive. And you were awarded the prestigious Thiel Fellowship, which everyone is kind of talking about. And what was the experience like? Can you tell us a little bit more? How did that basically, the Thiel Fellowship, how did that shape the way you think? And how did it, prepare you for like future?
Yeah, I mean, I'd been aware of it for a long time when I dropped out. And I think what they do such a good job of is making people aware that there are other paths, that like you don't have to always take the traditional path of do your undergrad, do postgraduate, go into research. Like there are other ways to make an impact. And in particular, if you want to start companies, that maybe having an undergraduate degree and taking the classic path is actually not the way to go, and diving into the real world and building companies and starting that as early as possible can be a better path for some people.
Yeah, that's amazing. And you also went through Y Combinator.
Yes.
Can you tell me a bit more what that is? From my understanding, and I've done some research, and it's one of the world's top startup accelerators.
Yeah.
And what was the biggest lesson you learned from it, or a cultural shock you took away from that experience?
Well, the whole thing was a bit of a cultural shock because it was the first time pretty much that I'd been to the US at all. So it was, uproot everything, move to California, move the whole company out to California, and kind of start building in a country that I knew very little about. But I think in terms of lessons, they really teach a lot in terms of knowing your customer and understanding your customer and really building. Well, I mean, the whole slogan is make something that people want. Right. So it's really simple. talk to your customer a lot, know your customer, and make sure that you're not just kind of working in a silo and building something that you think people want, but that you actually get out there and talk to people. And so we spent a long time during YC like driving to farms in the Central Valley in California and talking to farmers about what kind of tests they wanted and what kind of software they wanted, and then like building it for them. And so that was a really great experience. I think the other thing that they do a really great job of kind of teaching people is to think about scale, particularly in startups.
Okay.
So, if you're going to try and build a company around something, it has to be more than an idea that you're going to sell to one or two people.
Okay.
Right? So like, what is the total market for what you're building? And is that actually big enough to support a company? And in particular, if you want to make it a venture-backed company and you're trying to get returns for a VC that makes sense, that kind of level of scale that's required is much greater.
So what's also the demand and understanding the demand for it?
That's what then led to, eventually we pivoted that company into human testing, kind of using the same technology, but applying it in human diagnostics instead, because the market in cows was just literally not big enough. Tested every cow every year in the US.
Oh, wow.
It would be like maximally 1.5 billion of revenue. That would be the maximum you could get if everybody tested every cow every year. And obviously that's not practical. You're not going to get everybody testing every animal every year. And so the market size is just too small for that to be a venture backable business.
I understand. Okay, so we talked about your kind of what made you leave Oxford, come to US, and your previous experience, and now you are working on Curative, which has been going really well. So for those who don't know, how did Curative start? What is it? And how did it become one of the most recognized healthcare startups in the US?
So quite a few pivots. When we first started the company back in January of 2020, the original idea was actually that we were going to try to improve sepsis outcomes for hospitals.
Okay.
And so we were going to take patients that came in through the emergency room with a sepsis diagnosis and sort of pull them off and manage them ourselves and basically get really good outcomes. The idea was that community hospitals just have too much going on, and they end up not being very good at managing septic cases that come in, particularly if they come in on a weekend or an evening. And if you could consolidate the learnings across many hospitals to have a team that were just excellent at sepsis, that you could get better outcomes, both for the patients and then also financially for the hospitals.
Because sepsis is life-threatening and it's quite common as well, unfortunately.
Yes, 200-something thousand deaths per year in the US, billions of dollars of spend, so it's a big problem.
Yeah.
We did that for a whole 6 weeks, and then COVID-19 hit, and we had a clinical trial planned at a hospital in Wisconsin, and they were usually an incredibly responsive team. They would follow up with us really quickly on everything, and we got, instead of the PI that we're dealing with, we got his assistant send us an email saying, "I'm sorry, but he's not going to be available for 6 months, and you guys can't move forward."
PI is the principal investigator.
Yes,
so it's like a doctor. I mean, I work in trials, so PI is like my good morning, but it's a principal investigator. So it's like a doctor who's like he has the main responsibility for the study, and he recruits the participants, patients.
Yes. And so we'd worked with this guy before, he was always like super responsive and really interested. And for him to say, oh, this is like canceled for at least 6 months was quite shocking. And that was, I think for me, the first sign that this COVID thing might be a bigger deal than people were making out. This was February of 2020. So pretty kind of early.
Early stages, yeah.
And so, we'd raised about $1 million of seed money for the company to work on the sepsis idea. And we were kind of like, well, what do we do now?
Yeah.
We can't move forward with the trial that we promised the investors that we're going to run.
Yeah.
Maybe we can help out with COVID-19 testing for a few weeks until this whole thing
idea.
blows over. And then we'll get back on with the sepsis thing. Obviously, COVID lasted a little bit longer than the few weeks that we anticipated. We ended up acquiring a lab in LA, hiring 7,000 people, and we grew it to about $2 billion of annual revenue at the peak, about 10% of all US COVID testing, 36 million tests, 2.5 million vaccinations across 49 states. So it grew really fast. It was quite, I don't think I've ever slept so little in my life.
Imagine,
the entire team.
The way it all started, no one expected it to be so big and to last so long.
Right.
And it's still part of our lives.
Right. So we, the demand was just if we could make a test, somebody would want that test. And so it was, how do you just scale this up? And we focus a lot on what we called at the time an orthogonal supply chain. And so this was, if instead of just competing with other labs for the same testing supplies, because that's like net zero, that's pointless, right? You're just fighting for the same things. How do we bring on testing supply that is net new, right? So using alternative sources, alternative materials, like can we find swabs that are not usually used in diagnostics and repurpose them? Can we, make the plastic tubes rather than buying the plastic tubes? Can we use research PCR machines and qualify them? And so it's kind of bringing on like a lot of new testing capacity that you wouldn't otherwise have had, so that we're actually boosting the total number of tests rather than just like squabbling with other labs for the same supplies, which is basically what everybody else kind of ended up doing.
Yeah, that's really amazing. Thank you for sharing those insights. And I can't say whether you really experienced the system, the healthcare system in the UK, but I'm someone who works in national health system in the UK, and you are very familiar, obviously, with US healthcare system. What do you think are the biggest differences between the two, and how can one learn from each other, or like is one better for the patient than the other? So that's a bit controversial, I guess. We don't know, but do you think that there is a massive difference? And is there something that maybe US can learn from UK healthcare system or vice versa?
Yeah, I think it is, which one's better really depends on a lot of the specifics of the situation. I think, the one problem that we see a lot in the US healthcare system is the cost for the patients, right? In the British system, you have copays on pharmacy, but not if you have a chronic condition. And that's basically it. Compared to the US, where the average person's out-of-pocket cost is about $2,000.
Yeah, it's quite expensive.
Right, and many people are now on these high deductible plans where they may have $5,000, $6,000, $7,000 deductibles, $10,000 out-of-pocket maximums. And so you really only have catastrophic coverage. If something really terrible happens, it would kick in. And what we see at Curative is that drives this pattern of kind of care deferral, that people put off seeking the preventative care because they don't want to pay $100 for it. And there's kind of this just complexity of people not really knowing what is it going to cost me, even if technically it would be zero, because a lot of preventative care is covered at zero, but nobody understands. Nobody knows what is and isn't covered. Everybody has heard some horror story from a friend or a relative who went in for a colonoscopy and it was supposed to be free, and then they found something and now it's diagnostic and not screening, and they get a $2,000 bill. And so that just puts people off seeking care. And so that was one of the kind of founding ideas when we pivoted out of the COVID business and into health insurance. So obviously COVID was kind of winding down 2021, or we thought it would end much earlier, actually. We started planning for the end from the middle of 2020. We kept testing all the way through the end of 2022. So it lasted a little bit longer. But we kind of were focused on, what do we build next? We had a lot of capital, we had a great team, we had a brand around Curative. What do we build next? And we looked at a whole bunch of different stuff. We looked at some stuff in diagnostics that would maybe make more sense as a pivot. There was nothing that was like that exciting. We briefly looked at buying a hospital. That was a really interesting thing to explore. Really glad we didn't do it, but it was an interesting idea. And then we eventually settled on building a new health insurance company. And a lot of this came from what we're seeing, some of the data on out-of-pocket costs, that it's just been going up and up and up every year. And all you're doing is driving patients to not take care of themselves, get sick, and then end up getting a much higher level of care later. And so if you can get them to get taken care of early, you can prevent a lot of that stuff, keep them out of the hospital, and keep the total cost down. And circling back to the question, I think that is what could really be learned from the British system. Is in the US, there's this idea that if you don't charge copays and you don't have some skin in the game and have some consumerism, that people will just go to the doctor all the time and massively overutilize healthcare. And the reality is, it's just not really true. People have better things to do than go see the doctor. Like, people usually, what we find is actually getting them to go see the doctor at the right time is the hardest thing, because people find every excuse to avoid doing that preventative care. And that the people who are going to abuse the system, the people who are going to overuse, they'll do it anyway. No matter what deductible and copay you put in place, they're going to find a way to get in. What the cost sharing ends up doing is hurting the people who won't access it because of that $50 copay. that are going to end up in the emergency room and end up in the hospital with a $100,000 bill.
Exactly.
Just because you made them pay $50.
Exactly.
And so you're not really helping. All you're doing is saving a little bit of money in the first year, kicking the can down the road and paying more for it downstream. And there's tons of research and literature on this now. There's a study last year on like what is the cost of a copay, and showing that it actually, in terms of health outcomes, like it costs lives to have this cost sharing. And so what we wanted to design at Curative is a plan that doesn't approach it that way. Yeah. And so we have all our members basically start out the year with $0 out of pocket. So no copays, no deductibles, no co-insurance. Probably to a British audience, that doesn't sound that exciting. But in the US, that is like
huge.
very different from what people are used to. And everybody gets that for 120 days.
Yeah.
And then during that 120-day window, the members have to complete something that we call the baseline visit. So it's basically a mix between an onboarding to the plan and a true preventative health visit. You do it with the Curative team.
Okay.
It's 45 minutes to an hour long. It's a Zoom call for most people. And as long as you do that, as long as you show up and give us 1 hour of your time to think about preventative health, then you keep the no out of pocket for the whole year.
I think
the key is if you don't show up, if you won't give us that 1 hour of your time, then on that 121st day, you go back to having a $5,000 deductible and 20% co-insurance.
Okay.
So if you don't show up and do the prevention, your healthcare is going to cost $5,000 if you need to use it.
Yeah. But prevention is the key. And that's what I even like looking, for example, at cancer, which we know that, in oncology, the treatments are very expensive, right?
Yeah.
But early detection is life-saving, and it can prevent all these huge bills and everything. And I know that your Curative has introduced this early multi-cancer screening through partnership with Grail. And you are focusing a lot on preventative care, as you said, which I think is crucial and the key. So I wanted to ask you how close you think we are to this future where the disease is really caught before it actually starts.
Yeah, I mean, I think it's nice to kind of think about like the sci-fi version of this, but like the reality that we see on the ground is that we're so far away from even just getting people to do the basics.
Yeah.
Like we do this baseline visit, 98% of people come do the baseline visit. So we get almost everybody through it. And some of the stuff that we find at the baseline, it's insane that people haven't found this before. We have had members come through and just openly tell the clinician that they have HIV and they've never taken the meds because it seemed like it'd be expensive. Like that was a real patient case.
Oh, wow.
And it's like, well, clearly that's very bad. Like it's very much a treatable disease. The drugs will be covered at $0 on the Curative plan, but that person is not taking care of themselves because of what that cost has done.
Yeah.
And so we do also cover things like the Gallery test from Grail, which is a very advanced new diagnostic that can pick up these cancers at stage 1 or stage 2. It's 50 different cancers from a single blood draw. And that's amazing technology.
Yeah.
And we try to get as many of our members to do that as we can at the baseline visit. And that certainly is allowing us to catch some of these cancers at an earlier stage.
Yeah.
But I think there's also just so many low-hanging fruit on, people coming through the baseline visit, and you got 10% of them have done their colonoscopy, 20% of them are following the mammogram protocols. And so there's so many other low-hanging fruit as well in just getting people to do the basics, like the things that we know work. Getting your diabetics to actually take their medications and manage those and get them connected to primary care.
Yeah.
Getting people with hypertension to take their antihypertensive medications and to work with a primary care doctor to make sure that if their medication isn't working for them, that they
switch to another or...
Right, but there's so many people who come through and are just not managing the conditions that are like simple and we know how to manage, but for whatever reason, they're not engaged with the healthcare system. They're either disillusioned, the cost barriers there, or they have this fear of cost that just keeps them from accessing care. And those are your incredibly expensive cases in a few years' time that you could avoid all of that morbidity and cost, and obviously just get much better outcomes if you get those people to engage now. So while we do love to focus on the advanced diagnostics, and I think there are some really exciting things there, I think we still, like as a healthcare system in the US, need to do a better job of just covering the basics. Like the basics are just not getting done for so many people. that's really kind of got to be the foundation of everything.
I agree. Thank you so much for that. And is there any wellness ritual, supplement, or daily hack or habit that you swear by and you do every day, and you know that helps you concentrate and manage your time and work so effectively? Or you might not have any? I don't know.
For me, I mean, I think running is the one thing that I've like sort of always done since I was a kid. My mom was a runner. I got into it really early, and in terms of like finding exercise routines that I can stick to, it's just like it's running something that's always been there for me, right? I can always fall back on it.
Exactly.
All I need is a pair of trainers, and I'm good to go. And so it's not every day, but I try and run about 20 miles a week.
Oh, wow, that's impressive.
And just record it on Strava, keep it consistent, and just every week got to hit that goal. I'm 3 weeks away from a 100 weeks streak on Strava. So.
Oh wow, congratulations. That's dedication.
Almost there.
And since what I said at the beginning, you've taken a non-traditional path and you built something powerful, what advice would you give to someone who's watching this, who wants to be a young founder, especially someone tackling healthcare, someone who wants to follow your footsteps?
I think I would say really make sure that it's what you want to do, because starting a company is a lot harder, I think, in reality than it's often made out to be. And there's a lot of days that are not fun and not sexy and not, not a good experience. There's an Elon Musk quote that starting a company is like chewing glass and staring into the abyss. And I would generally have to agree with that. But it also can be the greatest thing, and it's one of the best ways to have an impact. But I think if it's something that you want to do, you need to be fully committed to what you're getting yourself into and be working on something that you're passionate enough about that you're going to want to put in that time and want to put in that work, because it's not going to be easy.
Yeah, definitely. You have to love your job. I know it sounds cliche, but if you don't love what you're doing, you can't have a big impact and you can't grow. And
you can't just love the idea of building a company, right? You have to actually love the problem that it is that you're trying to solve.
The actual work.
Yeah.
Well, that brings us to an end. Fred, thank you so much. This was very insightful, knowledgeable. I feel like I learned so much. And thank you for joining me today. And for the listeners, I release episodes every Tuesday. If you like this one, please remember to subscribe, like, share, and get in touch with me. See you next time. Thank you for watching. Bye.